Welcome to part 2 of ventilation. We're going to talk about pressure measurements used in pulmonary physiology. Pressure measurements used in pulmonary include the driving pressure, the transrespiratory pressure, the transmural pressure, the transpulmonary pressure, and the transthoracic pressure. Driving pressure is the pressure difference between 2 points in a tube or airway. It is the force moving gas or fluid through the tube or vessel. If a gas pressure at the beginning of a tube, as pictured, is 20 millimeters of mercury, and the pressure at the end of the same tube is 5 millimeters of mercury, then the driving pressure is 15 millimeters of mercury. And so the force required to move the gas through the tube in this case is 15 millimeters of mercury. That's driving pressure. Transrespiratory pressure is also called trans-airway pressure. They're the same thing. And transrespiratory pressure is the difference between the barometric or atmospheric pressure and alveolar pressure. It is the pressure gradient between the mouth, atmospheric pressure, and the alveolar pressure. For example, if the alveolar pressure is 755 mercury and the barometric pressure is 760 during inspiration, then the transrespiratory pressure is 3 millimeters of mercury. 760 minus 757 is equal to 3 millimeters of mercury. Transmural pressure is the pressure difference that occurs across an airway wall. The transmural pressure is calculated by subtracting the intra-airway pressure, or P sub IAW, from the pressure on the outside of the airway, or the P sub OAW. Positive transmural pressure is said to exist when the pressure is greater within the airway than the pressure on the outside of the airway. For example, in A pictures a positive transmural pressure. The pressure on the inside of the airway is 765 millimeters of mercury. The pressure on the outside of the airway is 760 millimeters of mercury. 765 minus 760 is equal to a positive 5 millimeters of mercury, or a positive transmural pressure. In picture B, we have a negative transmural pressure. A negative transmural pressure is said to exist when the pressure is greater on the outside of the airway than on the inside of the airway. For example, you can see in airway B, the pressure inside the airway is 755. The pressure on the outside of the airway is 760. 755 minus 760 is a negative 5 millimeters of mercury, or a negative transmural pressure. Transpulmonary pressure, or P sub Tp, is the difference between the alveolar pressure and the pleural pressure. For example, if the pleural pressure is 756, and the intraalveolar pressure is 760, this duration, then the transpulmonary pressure is a -4. For example, if the pleural pressure is 755 and the alveolar pressure is 760, as pictured in A, then the transpulmonary pressure is 5. This happens in inspiration. Pictured in part B is expiration. This assumes that the alveolar pressure is 763 and the pleural pressure is 758. Then the transpulmonary pressure is 5 millimeters of mercury. In the normal lung, the alveolar pressure is always greater than the pleural pressure, which in turn maintains the lungs in an inflated state. The last pressure we'll talk about is transthoracic pressure. Transthoracic pressure is simply the difference between the alveolar pressure, the pressure in the alveoli, and the body surface pressure. The body surface pressure, remember, is also equal to atmospheric pressure. Let's look at an example. In part A, gas flow is going to go in because the alveolar pressure at 755 is less than the body surface pressure. This creates a transthoracic pressure of -3. On expiration, pictured here in part B, gas is flowing out. The alveolar pressure is actually higher than the body surface pressure. The alveolar pressure is 763. The body surface pressure, or atmospheric pressure, is 760, creating a +3 transthoracic pressure. So the pressure measurements used in pulmonary physiology are driving pressure, transrespiratory pressure, transmural pressure, transpulmonary pressure, and transthoracic pressure, which are all pictured here. In summary, driving pressure is just the pressure difference in any two areas of a vessel or an airway. Transrespiratory pressure, also called trans-airway pressure, is the difference between the barometric pressure and the alveolar pressure. Transmural pressure is the pressure difference that occurs across the airway wall or between the inside and the outside of an airway. Transpulmonary pressure is the difference between the alveolar pressure and the pleural pressure. Transthoracic pressure is the difference between the alveolar pressure and the body surface pressure. Thank you, and this ends our presentation on pulmonary airway pressures.